Hi, everyone. My name is Li Juan Huang, and I am a psychiatry mental health nurse practitioner. So today I will discuss how I would handle a psychiatry crisis involving a 45 years old male diagnosed with major depression disorder. So he recently discovered that his wife has been unfaithful and has taken the children away. So since then, he reports feeling hopeless, drinking heavily, and has expressed thought of shooting himself. So when facing a crisis like this, my first priority is to remain calm, compassionate, and non-judgmental. So I would start by acknowledging his pain and validating his emotion. I might say, you've been through something incredible painful, and it makes sense that you're feeling lost and overwhelmed right now. Empathy builds trust and help reduce immediate distress. It also creates a safety needed for open discussion about suicidal thought. So next, I would conduct a structured suicide risk assessment using the Columbia Suicide Severity Rating Scale to evaluate the risk level. These two help assess the frequency, intensity, and of the suicidal thought, along with any plan, means, or intent. Research shows the standard assessment combined with emphasis inter- interviewing reduce stigma and improve early crisis detection. So in this case, several high risks indicated are present. Um, Suicidal ideation, access to a firearm, recent major losses, alcohol misuse, and hopelessness. So this combination signal an acute emergency. So to ensure safety, I would make sure he's not left alone, and I will ask about the firearms location and ensure it is removed safely by a trust individual or law enforcement if necessary. So I would then initiate a referral to the emergency department for immediate psychiatric evaluation and possible hospitalization. If he refused the volunteer care, I would follow state law and begin the involuntary commitment process, as the risk of self-harm is intense. While awaiting transfer, I would stay engaged and focus on protective factor. For example, his love for his children, his faith, or any supportive friend or family. Reinforcing this factor can provide a sense of hope and connection during a moment of disappear. Once safety is secure, the next step would be post-crisis follow-up. So his ongoing care plan would include pharmacology management for depression, possible with SSRI or SNRI, referral to therapy for grief and coping, and substance use counseling for alcohol misuse. I would also recommend community support such as peer group or behavioral health crisis program to enhance recovery and continuity of care. As a study shows, community that invest in behavioral health crisis system, including mobile crisis team and same-day follow-up, um, see reduced emergency department utilization and improvement patient outcome. So finally, I would emphasize that depression is treatable, recovery is possible, and he is not alone in this process. So in summary, my approach integrate empathy, structured suicide risk assessment, immediate safety planning, and post-crisis follow-up. These steps together promote both short-term safety and long-term stability. Thank you everyone for watching my video again.